All right, good afternoon, everyone. I want to thank you all for coming out here today. I'm accompanied by MLA Jeff Bariza, and you can see we have a lot of concerned citizens and residents here to speak about the consumption site at 366 Henry. So we are here today as a leader of the PC party, as MLA Jeff Bariza and the entire caucus, and to support the residents and businesses of Point Douglas and North Logan in opposing this drug injection site. The PCs have support the letter being sent to Health Canada documenting the community's concerns and the flaws in the selection process and consultation process at 366 Henry. We, as the PC caucus and the leader, have also sent a letter to Health Canada echoing those concerns and urging Health Canada to reject the application by the NDP to put the drug injection site on Henry Avenue. These letters to Health Canada do a very effective and clear job of dismantling the government's case to force the drug injection site onto Point Douglas residents, North Logan residents, and business owners. The letter points out the lack of accountability and need. There is no baseline data on the numbers of overdoses currently in the neighborhood for the last 12 months to 24 months. The NDP say they will supposedly improve health outcomes without increasing risk to public safety, yet there is no defined success indicators or measurable outcome tied to this proposed site. And there's no explanation of how success will be evaluated, reported, or audited. How can the NDP even know what benefits will be when there's no measurement of so-called success? Again, there is no baseline data on which the NDP are going after when it comes to this location. The NDP have provided no information, no resources on staffing, and not provided a transparent operating budget. There are no long-term funding commitments, clear accountability and oversight mechanisms, or defined staffing levels and escalation protocols. We have Manitobans now waiting in the ER for over 20 hours. We have a Manitoban who died in the hospital after waiting 30 hours. We have a Manitoban waiting over 11 hours for paramedics to arrive. This premier falsely stands up and says we have enough nurses and everything is okay. Then why are people dying under this NDP government waiting for help? The application does not address Winnipeg Public Service, Winnipeg Police Services enforcement mechanism for loitering, public drug use, or paraphernalia disposal, coordination with the police, EMS, and municipal services. What is the plan? When you ask the Winnipeg Police Service, they say there is no plan. There is currently no current crime baseline for this community and this site. Planned enforcement changes for policies and paramedics are completely lacking from the NDP's proposal. For all the reasons I've listed and many more, Health Canada must reject the proposed Henry location for the drug injection site proposed by this NDP government. On that, I'll now pass it to our addictions and homeless critic, MLA Jeff Bariza from Portage La Prairie.
Thank you so much, Leader. My name is Jeff Bariza. I'm the MLA for Portage La Prairie and the Deputy Leader of the PC Party of Manitoba. Today, I am here to represent the people of Point Douglas and North Logan on this proposed site where no one has been able to get any information. We had 3 or 4 meetings that there was questions asked, no answers. How can we play with people's lives and business, as well as the people that are suffering from this drug addiction? We need to do better. The NDP government is trying to shove this building without any data or anything to support this. What we need is wraparound services. We need to help these people to get off these drugs. We need the justice minister to be going to Ottawa and saying, why are these people that are supplying drugs not being treated like murderers? We need to help this location and this neighborhood here that many people I've heard have lived here for 30, 40, 50 years. Now they struggle to get home insurance. They struggle to get business insurance. And they struggle to make their, they're worried about their kids. So again, we support the leader. We support the neighborhood here. This is not the thing to do. I will ask one question. Would you give a drowning man a glass of water? The way to help this is with a hand up, not a needle in someone's arm. Thank you.
Okay, on that, we'll open it for any questions from the media that's come out today.
Is it just this site, this location that you're hoping to, that you want Health Canada to oppose or not allow? Or are you opposed to a site in any location? Is there any location where you would be okay with the supervised consumption site?
Yeah, this is a great question. And this is the site that the NDP came forward after the public pressure. The NDP government had tried to hide the previous site on Disraeli Highway. They then moved to this location and didn't tell residents about it until they'd already put the application for us. So this is the one that we're dealing with now with the current NDP government. We have said that as a party, and as a community, as a society, that we want to help people. We want to get people wraparound support. We want to get them off of drugs. We want to help them of where they're at in their life, not provide them a place to consume drugs. So fundamentally, we are against the concept of having a drug consumption site. We want wraparound supports. We want help for Manitobans when they need them. When we talk about compassion and realism, we all have loved ones. If any of our loved ones were going through this, whether it be drug addictions or alcoholism, we would offer them support. We wouldn't give them more alcohol. We wouldn't give them more drugs. So why is it okay for Wab Kinew and the NDP to force a drug consumption site and this location at 366 Henry when the residents don't want it, when the businesses don't want it? They are fearing their livelihood, the lives of themselves and their children. And the NDP government refused to listen to anything these people have to say. So as a leader of the party, we are going to proudly take this forward and say the NDP need to stop, do the right thing, the compassionate thing, and that is to help Manitobans.
I've not covered a lot of this recently, but just wanted to clarify, sorry, have you seen the application that was submitted to Health Canada?
We have seen the briefing notes on the application for this location and everything that we outlined in our letter and the North Logan businesses residents have outlined. It's clearly laid out that the NDP do not have a plan. There is no baseline data from which they are referring to. They're under the auspice of an emergency need for this, and yet they don't have the data. They will not provide a plan. They have not talked about financials or staffing or emergency situations. It's literally like they're just making up as they go because they think this is a win for them and they think that the residents of Point Douglas and this area here won't say anything. Well, they are. And they're speaking loud and clear. If you went to any of those meetings, it was unanimous in the room that anybody that lived there or had a business there doesn't want it. I have yet to see a business come forward in this area that says we want this in our backyard. If the Premier wants this so badly, then why won't he put it in his writing? Let him put it in Fort Rouge. Let him put it in Tuxedo or Waverly or Lagimodiere, where one of his NDP MLAs are. Because on our side, we do not want this.
Have you seen any similar situations where Health Canada has rejected a proposed site based around similar points or similar concerns?
Yeah, I wouldn't be able to comment on that specifically. Again, as a leader here in Manitoba, my concern is the residents, the people of Manitoba. And it's heard loud and clear that they don't want it. People want compassion and treatment and services, wraparound supports. Previous PC government, we opened 7 RAM clinics. NDP government has only opened 1 RAM clinic. to provide services for Manitobans. This is unacceptable. It's a lot of big announcements, a lot of flashly talk, but when it comes to actually listening to Manitobans, the people behind me are people who live right here. Ask any one of them what their thoughts are on this. Ask any one of these dozen businesses that are directly affected by this. Families that live down the street. I heard from one member here, he raised his daughter here whole entire life, and now he's afraid of what's going to happen to this community. They love this community. We love this community. That's why I'm in the position I'm in. I love this province. I love Manitobans. And the answer isn't giving someone a place to do drugs. The answer is helping someone when they're in need. And that is through wraparound supports and recovery.
Sorry, but can I interrupt you 1 second?
I mean, go ahead, Romeo.
Romeo, do you want
Romeo, you want to come up here?
you wanted the mic?
You asked a question on how this was presented. And I know because I've been living in this community for close to 36 years. I raise kids in this community who are proud members of Canadian Armed Forces today. Okay? But they presented, and you all know, as a safe consumption site. There is a difference on the rules of Health Canada on how you apply for a safe consumption site and what they are trying to put here. Now they are trying to shovel it on our throat without Vaseline, because this is not a safe consumption site rules. However, if you all remember it, this was sold and it been spoke in the words of Minister Bernadette as a safe consumption site. The only thing Minister Bernadette have done so far for me is bring me Bannock at the legislative building when I was protesting there. The Bannock was very good. However, we not need this here. We may put a Bannock factory there. She have the very good recipe. But please ask her, where are the rules for a safe consumption site and where are the rules for what they actually want to open here? They lie to us in every aspect of this process. Thank you.
What's your name, sir? Do you mind just saying?
Romeo.
My name is legally is Isidro Romeo Zapata. I don't want it to confuse with my son. Isidro Romeo Zapata, been living in this community for over 36 years. And this is a community built in 3 pillars of the community. You have residents, you have businesses, and you have social services communities represented here to every aspect of those 3 pillars of this community. This is not just the core area. This is a place where kids grow, go to school, and work. We are a solid community, and we're going to stand for it. And they not expect that.
Here. Good job, Romeo. Good job.
Do you mind if I just ask the spelling of your first and last name?
Isidro, Isidro. Romeo, Romeo, and Zapata, Zapata, like the Mexican rebel.
What do you think will change within the neighborhood if a consumption site opens here?
What I can tell you is what I want to see there. I want to see there a project like we used to have in Logan House. I've been here living long enough in this community. Logan House, we used to have a recycling center for cardboard boxes. We used to have a building pallet out of used pallet for wood composters. And there used to be people working there who have no jobs and making some money. That was over 30 years ago. I was part of that recycling place on Logan Avenue. That's what I want to see. That place where you're talking about the future, that's what I want to see. I cannot say anything else.
I'm going to thank you very much, Romeo. Really appreciate that.
Good job, Romeo.
Hi, Joseph Forey. I am founder of the Singing Red Bear Foundation and grew up in Point Douglas. And I want to answer that question, what's going to happen here? I'm 7 years in recovery, had a very serious heroin addiction. And in Edmonton, I lived my life around a consumption site. And what happened in that area was not too long after that, trap houses are built up. Drug dealers are coming in because they know, as a drug addict, I know that I can buy my drugs here and then I can use my drugs here. That is what's going to happen here. I can say without a doubt that will happen here. Now, there'll be statistics that say that counteract that, but with lived experience, I know what's going to happen here. Mm-hmm. Now, when we talk about a drug problem and an addiction problem, I lost my son in 2023 to a fentanyl poisoning. He wasn't a drug addict. He made a bad choice, consumed some recreational drugs believed to be fentanyl, poisoned with fentanyl, and he died. What we have in Manitoba right now is a fentanyl crisis, a drug crisis, not an addiction crisis. And we need to start addressing that. And that's not going to be addressed by putting a consumption site here. You know, and the more that this government puts this crisis on addiction, the more that it tells the recreational user, the weekend user, that their drugs are safe. I know for a fact, because I've studied the numbers, that the number of deaths that are happening in this area are not as great as they'd like you to believe. Per capita right now, the highest death rate per capita in Manitoba is in the Norman region, in northern Manitoba. And they receive the least amount of resources as far as naloxone and any other kind of things like that. I make it my business because I don't want this to happen to another family, another young child, another young person. I know what it's like living with addiction. I've recovered. Winnipeg, Manitoba does not need this. I stand with Obby, I stand with Jeff, and I stand with the community of Point Douglas and saying enough is enough of having us be the dumping ground for these things. You know, we need to build this community up back to where it was. I remember Selkirk Avenue being a thriving community with businesses and Retsky's and the restaurants. We need to get back to that. We need to let these people know that they can be safe in their own communities, not have to fear what's coming down the pipe if this thing comes up. Because I was sitting in that restaurant and I was looking out that window and I was thinking, if this thing opens up, what are they going to look at? People are going to be lined up. When I asked Aboriginal Health, what's going to be the capacity? Well, under Canada Health policies, you can only supervise 6 people with 1 nurse. So you're going to have 6, how many nurses you're going to have? Well, I don't know. Where are the nurses going to come from? I don't know. Is it going to be 18, 3 nurses? What are they going to do with the people that are going to be waiting outside to access? How long are they going to stay? You know what they said? It's going to be like a lounge. They can do the drugs and then they can enjoy their high and then they leave. Well, how long is that going to take? They have no plan. And to be able to just force this on our people is wrong. So I stand with them, and anything that they need me to do and say, I will say it. We need a recovery plan in Manitoba.
Yes.
We need prevention and awareness for our youth so that they know that the drugs that are out there right now are dangerous. We need a balanced approach. We need enforcement. We need treatment. We need prevention and awareness. Harm reduction, yes, plays a role in it, but it's not the end all and be all. If we're going to get ourselves out of this, then it's going to be the people like people of Point Douglas and the business community that all come together and say, okay, we're going to be part of the solution. I stand here, I want to be part of the solution. For most of my life, I was part of the problem. But in my recovery, I realized that there's more to life, and I want to be able to help others, and I want to help the community of Point Douglas be the community that I know they can be. Thank you so much. My name is Joseph Forey.
Great job, buddy. Excellent.
I'm just going to wrap up with one last comment in case it doesn't come up, and I know the media is probably going to want to report on this, and you're going to have some stuff to say. So I know there's recently this McGill study that was out there and talked about crime rates and the decrease in crime rates. So I think it's very, very important to note that when you dig into that study, first of all, it was a very small sample size study, but when you dig in that study, you'll find that the crime category of break-in enters spiked by nearly 50%. That's the crime that really impacts neighborhoods. We're not talking about over $5,000 like the study was on major crimes. We're talking about that this study omitted crimes of disorderly conduct, petty theft, drug use, loitering, public nuisance, drug paraphernalia, graffiti, broken glass, visible drug use, human excrement, children, or the lack of children playing in the area, social services, running, people enjoying a park in those areas. There's more to measure than just crime. This study didn't talk about any of those things, so it's important to keep in mind that when you have residents, when you have business owners, when you have people coming up and saying, we don't want this here or anywhere, where we want recovery and treatment and help for people suffering through mental health and addictions, not something forced into their community in their backyard. It's important to keep that in mind. On that, I want to thank all of the residents, the business owners here in Point Douglas and Logan. Kelly. On closing, sorry, one last speaker. We'll get Kelly to come say a few words as well.
Good job, Kelly. Sorry.
Hello everyone, my name is Kelly Miranda. I hosted the recent community town hall on the proposed supervised consumption site at 366 Henry Avenue so residents and businesses could ask questions and have their concerns heard. At that meeting, Minister Smith stated that the province has an obligation to collect community concerns and submit them to Health Canada as part of a consultation. We are now hearing from Health Canada that the consultation is not required. These statements directly contradict each other. If consultations matters, we need transparency about how concerns are handled. If it doesn't, we deserve honesty. Right now, the messages don't align, and our community deserves answers, especially as the local businesses are already facing increased security costs and past experience with the concentration of services shows conditions often worsens rather than improve. Thank you.
Great job, Kelly. Great job. Thank you so much.
Oh, yes, yeah. This is good.
Good afternoon. My name is Beverly Burkhardt. I am the Executive Director of Winnipeg Intercity Missions. We have been working extremely hard for the last 3 years to develop our campus, which is on Logan, situated between Ellen and Laura. We have a 20-suite apartment building that has been providing for the last 17 years second stage sober living. And we are in consultation and have grant funding that we are exploring to put an addition on that building. Adjacent to our building is also a large green space, which is a commemorative art garden that acknowledges residential and day schools and victims of the 60s scoop. It is a place of gathering and learning. Adjacent to that space is a building at 287 Laura. We have been working for exactly 3 years to invest $1 million in renovations to that space to create an Indigenous Arts and Cultural Center that was identified as a need in this community. We've been providing to children in the inner city for over 30 years an after-school program, and this is going to be the destination location for children from Ecole Victoria Albert School and from Dufferin School, from King Edward School, from McCrae School, and from Nichimakwa schools. We have a bus and we are picking them up and they are coming to this destination. We have our occupancy permit and we are ready to launch. We are within the 250-meter parameter that was identified by Premier Canoe when they were trying to put this center next to the school at Argyle. It's unacceptable. We have got, you can go to the City of Winnipeg zoning and bylaw section, and you will see that we have been designated as a community center for youth programming and daycare. So there are many situations here that we are all confronted with respect to this center, but at the heart of the matter is the Premier himself has set these parameters and limitations and restrictions on where it can go, and we are being overlooked, and our children are going to suffer. I have got letters contained in my package I'm happy to share with you that come from the two principals at Ecole Victoria Albert School and Dufferin, and also a letter from a prominent, long-standing member, civil servant, Clayton Sandy, who all agree that they are going to have great reservations about the children coming to this location because of this proximity of the safe consumption site. Our children in Centennial neighbourhood have nothing. Their splash pad was torn down years ago, and they built the Housing First model, which is Home First Winnipeg, and now the children have to be walked to school because of the consumption that is happening in front of that Housing First building. This is about our children, it's about their safety, and we need to hold the Premier accountable for the parameters that he has put in place. Thank you.
Excellent. Great words.
Thank you all very much for attending. Thank you, everyone. Thank you all.